Margie here. The holiday season's coming up, but yet there are many people who are not joyful. Instead, they say they're depressed. But what is depression and what can be done about it? Well, this is the topic that we're delving into today with our very special guest, Dr. Achina Stein. And Dr. Achina is the author of What If It's Not Depression? Your guide to finding answers and solutions. She is a board certified psychiatrist and has been in practice for 25 plus years. Propelled by her son's health crisis in 2010, she found functional medicine, which resolved all his mental health problems as well as her own. She has a busy private practice called Functional Mind LLC in Riverside, Rhode Island, where she sees patients for functional medicine primarily, but also sees patients for psychotherapy. She is a certified practitioner of the Institute for Functional Medicine, a distinguished fellow of the American Psychiatric Association, and was awarded the Exemplary Psychiatrist Award by NAMI-RI in 2008. She is a former clinical assistant professor of psychiatry and human behavior of the Warren Alpert Medical School of Brown University. She has a companion program to her book called What If It's Not Depression? And it's a boot camp to provide an alternative to medication for people with chronic, mild depression-like symptoms that do not respond to antidepressant medications. And she's also going to be offering an SSRI tapering course soon. And a random fact about Dr. Achina is that she enjoys playing ultimate frisbee, singing, and gardening. And in today's talk, we really do go into depression, what it is, what it's not, and all of the things that can be done when we look at it through a functional medicine lens. So lots of fabulous information. So stay tuned. Welcome, Dr. Achina. We talked about being on the podcast a while ago, so I'm so glad that you're here and welcome.
Oh, thank you so much. It's my pleasure to be here. I'm so happy to see you again.
You know, this is the perfect time to talk about depression because so many people think they should be happy, they're not happy, and it's just something that, we don't even know. So maybe let's start from the beginning, actually. Like, how does someone even know if they're depressed, if they're just sad? Because we use those terms sometimes interchangeably. Oh, I'm depressed. But, as a psychiatrist, it's much more than that. And there's a real difference between just being sad and being depressed. So maybe fill us in on that.
Sure. Yeah, that's a great question. A lot of times you're right that people have been so informed in many ways about mental health and use buzzwords like, oh, my OCD or my ADD kicked in or something like that. And it's kind of thrown around, what's the word I'm looking for? Like just, willy-nilly sort of, way. And so depression is the word, I'm so depressed. I broke my nail, and obviously that's not a serious thing. And so the word, I try to get people to alter the way that they describe things a little bit more accurately and not use depression as a general term to describe a situation that is not serious. So, I'm frustrated, I'm upset, I'm down, I'm nervous, there's so many other words. And in my book, What If It's Not Depression, which is actually in the background on that side, I actually have like 100 words that you can choose from that might actually be a little bit more accurate than what you might use in terms of depression. So depression is a clinical term, and it is generally a feeling of being down and depressed or apathetic every day, most of the day. And depending on what condition that they have in the mood disorders, it would be a major depression. So every day, most of the day is a major depression. Every day, more times than not, would be a dysthymic disorder. And then, so it's different disorders based on feeling depressed. And then, so there's other symptoms that kind of go with that. And generally that depression is sadness or apathy or lack of interest in things. It's usually those three things, accompanied by other symptoms that would then become a clinical diagnosis. So that is basically, the explanation in terms of what is depression. So you can have sadness. That is a very normal emotion. It's normal to have sadness. It's normal to have reactions of sadness or upset about things. And it's a matter of allowing yourself to, have those emotions, even though they might be uncomfortable. So there's lots of emotions that are uncomfortable. And if you can allow yourself to have those emotions with this idea that it's not going to be there forever, and that it's not going to kill you or drive you crazy. So sometimes people go, oh my gosh, I can't feel this. And then they do something very reactionary in response to it, as opposed to saying, what is this all about? What's going on here? Why am I feeling this? Where did it come from? And being curious about it, even though it's uncomfortable, right?
I so agree with that, because so often we just disassociate from our bodies. And if we can just feel it in our bodies, deal with it, then we're able to move on. So I think that's such a good point that you brought up. So in
Right.
terms of, well, first of all, even before we get there, how did you get into really specializing in depression and doing all this work with depression? I know that's something that psychiatrists treat, but yet you wrote a book on it and you delved so much deeper. So how did that happen? I love hearing the backstory.
Yeah, sure. Yeah. It's, so, I was a traditional psychiatrist for almost 2 decades. And now it's been 26 years, I think. I always age it. What's my son's age? I started before then, my oldest son. So it's been a long time that I've been working, and I've been working as a functional medicine doctor for the past decade, I would say now. And so when I was a traditional doctor, I saw all sorts of patients for all sorts of reasons, and worked in many different settings, like the community mental health center. I was a medical director in that. And I've worked on the inpatient unit, geriatric unit. I've done consultation liaison. I've worked in the prison system. I'm one of those people that likes to do a little bit of everything. So I moved around quite a bit, just because, like, oh, this is exciting, So anyway, the reason I got into functional medicine was because my son actually had an acute mental health crisis. He was 14 years old. And there was a day where he had a tiff with his brother, and suddenly he was gone from the room, from the whole apartment that we were staying in. We were actually in France. My husband had been on a sabbatical, and we took all the kids out of school and brought them with us. And so we were in this 2-bedroom apartment. So he couldn't have gone very far. And I look out the side of my, from the side of my eye, I see him standing outside the window of the 5th floor, ready to jump. And yeah, overnight.
Oh
He
my
had a change
goodness, this is
overnight.
terrifying.
Yes, I was terrified. And so, I got him back inside, and, once we got home, I had him see a psychiatrist, and he was seen for an evaluation. And obviously I did all the right things in terms of getting him help, seeing a therapist, getting on meds at the time. And so he was on 4 medications for a variety of reasons, but he was not the same person. And he was only a little bit better. He was a little bit better in terms of his mood, and no longer suicidal, but he was anxious. He had insomnia. And the thing that was very perplexing was, at the time, he suddenly could not read. And it was that symptom that didn't explain it. Because, both my husband and I have depression on both sides of our family, serious depression. Yeah, and even suicide in our family. So it's, I just thought, okay, well, my kid's on the path. He's got the genetics, and like, this is it. This is life. But and as if this one symptom was not there, I always wonder, what would I have done anything different? But it was, he couldn't read anymore, and no one could explain that to me. I took him to so many doctors. And so during that time, we basically had him learn through audiobooks. Fortunately, the textbooks had it on audiobooks, so he could listen while he was learning, and we would read the books that he didn't have audiobooks on. And so I took him to many doctors, and I was just very frustrated because nobody could answer my question. And so I finally serendipitously was searching also to find answers for my patients, because I would hit a point where I was seeing someone, it's like, why aren't they getting better? There's something I don't know. There's something going on that I just don't know. And I wanted to search for answers. So I was looking for integrative, more training in integrative medicine and psychiatry. And so I happened to find a functional medicine doctor by the name of Edward Levitan. And he was at Visions Healthcare in Dedham. And he saw my son, and long story short, he got him well using the functional medicine approach. He had, because people always ask, so I might as well just say, that he was found to have celiac disease. He was nutritionally deficient. He had serious gut problems. And this was a kid who had severe constipation, always the kid that we were waiting for, when we were in restaurants, always the kid that sat on the toilet for a long, long time, severe constipation, severe eczema. And so I always thought of him as being healthy, but really he had clearly inflammatory issues from a very young age, since a baby. And so though, we cleaned up his gut, did a gut restoration, removing what's causing inflammation, replacing what's missing, re-inoculating the gut microbiome and repairing the gut lining. And he was better, literally better, just from the dietary changes in 2 months with just the dietary changes and changing. And what changed, the things that he had all his life was the constipation and the eczema in those 2 months. So he was on board with the rest of the program. And eventually, within 1 to 2 years, various of the symptoms of the mental health symptoms got better and better and better and better. And it took 2 years for the reading issue to get better. And the reason he had that is that he was so inflamed that the muscles of his eyes were inflamed. So he had double vision, and that's why he couldn't read.
What a story. This is an unbelievable story.
Yeah. So he got better. And, once you know what you know, you just can't go back to doing traditional medicines. So I literally left my job as the medical director of a community mental health center to do functional medicine with this doctor, Dr. Levitan. And I learned functional medicine. I was like a sponge. I had to know everything. And that's, ever since then, that's all I've been doing, really. That and psychotherapy. I mean, I still do psychotherapy with a handful of patients, but my practice is soup to nuts functional medicine.
It's so fascinating because it's not what people think, and it's funny because I so much talk about the bones and all of those issues, all of those things that can cause depression also are root causes of bone loss and osteoporosis, the inflammation, celiac, any sort of gluten issue, they're all the same type of thing. But for everybody listening, it's really worth getting evaluated and seeing if there are root causes, because how wonderful is that you figured it out. And now versus living a life thinking you have major depression on all sorts of medications.
Right. And he was able to come off of all of the medications. Come off all of them. And, once you know what you need to do to get better, if you fall off the wagon, so to speak, you know exactly what you need to do to get back on. So like when he went through college, he, like all of the other students, are up till 2:00 in the morning and, studying with the stress of studying for exams and writing papers and partying and, just not even eating well. So he had to be gluten, dairy, and soy free. So when you have relationships with friends and they want to go out to this place, of course, you're going to go out with them, and you're going to not want to be a pain in the neck to your friends and tell them like, I can't eat that. You just eat it. So, by the time he graduated, it's like we had to start all over again. So, but it was much faster to get well because he obviously didn't go all the way back to the beginning, certainly, he didn't need to be on medications again, but he knew exactly what he needed to do. So once he graduated and moved back home, within 6 months, he was able to get back on his feet again, not feeling so stressed and rested and eating well again. And so, that's the beauty of the functional medicine approach. And it is, like you said, it is something where it's not just your mental health that gets better, you physically get better. So everything that's missing in your body is the nutrients in particular, let's say, from food. Your whole body, every organ needs those nutrients, not just your brain. So it's not a siloed approach where you're seeing a neurologist for brain issues and a psychiatrist for mental health, and you're seeing a cardiologist for your heart, and you're seeing a bone doctor for your bones, whether it's a rheumatologist or what have you. But it's really it really addresses numerous issues, and it kind of clears the fog, so to speak, that if there are any symptoms left afterwards, then you can sort of pinpoint it. Is it genetics? Is it something that you're doing specifically that is aggravating an issue, like if it's a joint problem and it's your posture, then it might be very, very narrow focused to that specific problem. But usually it's inflammation that affects every organ. And then it's finding the 5 areas, really honing into 5 areas, which comes down to foods, infections, chronic infections, toxins, stress, and all of which affect your hormones, particularly cortisol, which is your stress hormone.
Wow. And all of those affect your bones, especially, with cortisol, that actually reduces the bone building cells. So there's such a correlation. But today, so many women are on antidepressants because they go to the doctor and that's the first line of defense. Let's put you on antidepressants, which a lot of people don't even realize the medication itself can reduce bone. It actually has an effect on bones and increased bone loss. But let's just go back then in terms of who should that be? Let's just go back to when someone's feeling depressed. Like, what should the next steps be then?
So, it really requires an evaluation, which obviously takes time. So if someone were to see a psychiatrist, most psychiatrists, so like in my day, when I first started as a psychiatrist, it was an hour and a half to 2 hour evaluation. But, most psychiatrists nowadays, they do an evaluation in an hour. And then it's really determining how severe the depression is and what are the factors that are contributing to the depression. So it would be biological, psychological, or social. So looking in the environment in terms of relationships like work, school, or at home. And so in a way, believe it or not, it actually is kind of root cause medicine, because if you're doing a full evaluation, you really are searching. So if it's psychological, is there abuse going on? If it's biological, is there hypothyroidism? Is there B12 and folate deficiency? And if it's social, are you having marital problems? Did you have a breakup with your boyfriend? Like that, those kinds of things, because all of those things can contribute to depression. So, a good evaluation will determine whether or not you are having an episode of depression that is severe enough that warrants the use of an antidepressant. And unfortunately, the way our system is set up, many people see a family doctor or a pediatrician or a specialist, and or even the ER doctor. I've actually had ER doctors prescribe medications and then refer, for further evaluations. Or it might be a therapist that might say, I think you need an antidepressant. They would tell the family doctor, and that sometimes a family doctor, unfortunately, doesn't do a full evaluation and blood work, because you're busy. This is a complex problem. And so if you see someone for 10, 15 minutes, they need to make quick decisions. And so they'll take, another, like a therapist's consideration, and you're seeing therapists for a period of time that, like, they think, okay, well, you know what you're talking about. But what gets missed are the medical causes of depression. And so you really want to do a full evaluation, and technically substance use should be ruled out. Technically, they should be ruled out as a cause before honestly giving an antidepressant. But sometimes, we have, again, you have to make quick decisions. When am I going to see this person again? So you sort of add that layer while you're removing those substances, whether it be drugs or alcohol, and hopefully that combination will affect the change. So there's all of these layers that have to be addressed. But because of time, lack of resources, lack of people to see, or things are put out farther and farther, that things get dropped. And then there's gaps in care. And so, people are given these medications because it's determined that the benefits outweigh the risks. And then there's sometimes the follow-up is put out really far out, 6 months later, when really technically it really should be within 2 weeks or at least a month out. And so people are sometimes given medications because there aren't any other options. Like, it's hard to get into a psychiatrist's schedule. So here's a medication. This is all I have to offer. But you need to have blood work. You need to be seen by a psychiatrist to see if this is the right thing for you. You should see a therapist to see if that might be, a better choice for you. But they sort of like want to put it all together in a 15-minute session. And so a person might walk away with a prescription and it might not be the best thing for them,
Wow. And the other thing is they're on it for so long. I've seen so many people, when they write down and they've been on antidepressants for years and years,
Right.
and it's just their norm. Oh yeah, I'm on this. No big deal. It's just like,
Right.
oh yeah.
Right. Sometimes though, people are put on antidepressants because they are having a breakup and they're in so much distress that rather than seeing a person for grief counseling, so to speak, and helping them work through it and assuring them that they'll get through it and, to have support around it, then, the only thing that's given is really an antidepressant. But so there needs to be a lot of discussion about what the benefits are, what the risks are, and there's sometimes not true informed consent because even the antidepressant discontinuation syndrome is not discussed, that that's a risk when you start an antidepressant, and that there's even risk of having suicidal ideations from an antidepressant. That's a black box warning on the SSRIs in particular. So it's important to have these discussions and many times in the interest of time, they don't happen.
The other thing is, how many functional medicine psychiatrists are there?
Not many.
Yeah, that's what I'm thinking.
Not many.
I'm just wondering how many people like yourself are able to really, I just think it's always so interesting how people got to what they're doing. And usually it's from their own individual situation or family member that they've gone through it themselves. I know my husband had a gluten issue, which he would have really died from, and he's an OBGYN.
Oh,
But
wow.
now because of that, it's something he immediately looks at. And so many people have really been able to improve their health because of what he went through. So the same, what you're saying. But
I agree. Yeah. So, the reason I wrote the book, What If It's Not Depression, as opposed to What If It's Not Anxiety, even though anxiety is treated with SSRI medications, is because that diagnosis is a wastebasket diagnosis for a lot of conditions. And it's an easy fix, so to speak. And I wanted to point out to people that for a mild depression, if it's a mild depression or an acute short-term low risk type of depression, that there are so many other things that you can do and should do before you are put on an antidepressant. And many times women who are at least the person that I spoke about in my book, Katie, it's like the average woman from 35 to 65 who's a multitasker, a perfectionist, does everything for everybody, works full time, mom full time, right? And gets sort of burned out at some point because her plate is so full and that she's not taking care of herself, that you can have this feeling of depression, right? Because it's just part of burnout, really. But that's not the treatment. An antidepressant is really not the treatment. In fact, exercise is equally effective and more appropriate, in my opinion, than an antidepressant for a mild or moderate depression. So there's so many other things you can do.
So what are the most common ones that you see now that you're a functional medicine doctor, in terms of that's really been missing, that people have totally not paid attention to?
Common, which one?
What are some of the common reasons people have depression that really aren't picked up in traditional medicine?
Oh, okay. Yeah. So, so stress is a big one. Yeah. Many people are under stress and don't even realize that they're stressed. And they might be happy, but still be stressed in terms of sort of like the classic example would be the Energizer Bunny, right? Just being the person that does everything, happy to do it, and they come home from their job. Like I have a patient who's a waitress in a restaurant, and she's like the jack of all trades. She's the person everyone goes to if they have a problem, and she's happy to do it and loves it, loves doing it. And she's like, I'll be right there. And she does this, she runs there. And she's the one who's running around for everybody and knows where everything is. And then she goes home and she crashes, and she thinks that's like normal. But then she decided to go to school to be a nurse, and she can't study. I mean, it's because she doesn't know how to pace herself. She doesn't know how to say no. And so underneath that is fear of rejection, fear of disapproval, right? Fear of not being liked, right? And that's what's really driving all of this, right? And so it's addressing those kinds of things in order to sort of pace yourself so that by the time you get home, you are able to do the work of nursing school at night, right? And she wasn't eating breakfast. She was working through lunch, right? She worked through her breaks. And so she was happy to do that, but her body was just burning out. But there's other things, chronic infections. Lots of times, when, I don't know if people remember that if they've ever had the flu or gotten really sick, that your mood changes, right? When you're not feeling good, you could be irritable, short-tempered, just down, even sad when you're not feeling good, because your body's inflamed. It's being attacked by whatever pathogen happens to be on board at the time. So the flu is a classic example of what can cause those mood changes. And so, but you can have other infections, chronic infections, that kind of jump on board. And a lot of times they jump on board because of stress and or poor digestion. And so the thing that connects those two, stress and digestion, is that stress shuts down digestion. So and it is your acid, hydrochloric acid and bile salts that are actually barriers that sterilize your food, so that if it is contaminated on some level, that it will die in that vat of acid that's your stomach, and it will be sterilized by the bile salts. So bile salts are like detergent that you would put in your dishwasher. So it's almost like going through the dishwasher to be cleansed before it hits your intestines. And so most people don't think of that as a root cause of inflammation that can ultimately cause what we call a dysbiosis, which is an imbalance of good bacteria with bad bacteria, causes a dysbiosis in your gut. And, so 80% of your neurotransmitters are made in your gut that your brain needs. And 70 to 80% of your immune system is actually made in your gut too. So it's like a 2-for-1. You can fix both of them pretty quickly, by addressing that.
And that will
So,
also improve your bones, because dysbiosis has been also correlated with bone health as
right,
well. So
right.
it's all related. So
Yeah,
interesting. The good news, though, the good news is there's a lot that can be done. And I think that's so exciting with
absolutely.
the work you do. But we were also talking beforehand about the power of the group. And sometimes it's better not to even do it alone. Can you sort of share? Because I thought that was so fascinating.
Oh, absolutely. Yeah. So I got very busy in my private practice working one-on-one with people. And in order to see more people and help more people, I decided to put this boot camp together that's called, it was originally called a Healthy Self Bootcamp, but I changed the name to What If It's Not Depression Bootcamp? It's a companion program to the book I wrote, so that you can go through the root causes of all the root causes of depression, which, as we've nicely stated in this episode, that there are the root causes of other conditions as well. So it's basically going through all the root causes, all the different steps that I do in my private practice, but instead it's with a group. And I was so pleasantly surprised that the people who did the group were actually in a better place compared to people that I saw individually. And the reason is because they were doing it with the group. Because when you're with a group, you get all excited about it. And when you're in a group, you might not be the first person to do things, but if there is a person in the group that's gun-ho and they just dive right in, and then the people who don't necessarily dive right in, they're a little bit more hesitant, or I don't know, or have self-doubt or confidence issues about it, or just not organized as well. We'll see the people who dove in, full force, that like, oh my gosh, you're so much better. And then they'll dive in, they'll do it, because then it gives them the confidence to be able to do those things. And so and everybody also cheers each other on and supports each other, but also gives each other pointers like, oh, I found this at this store and I love it. It's really great. Especially when it comes to dietary changes. I think that's the hardest thing for most people is to get their head wrapped around the idea of changing diets. I mean, there are lots of people who try different diets, and there's others like, oh, I can't be without that food. But if you have someone else who's already doing it, and they say, I love this gluten-free bread, I love it, it's so delicious, it doesn't taste any different, then they're more likely to go ahead and try it when you have someone else that's a peer, right?
Oh, I couldn't
Doing
agree
it.
more, because I do a lot of group programs, and there is so much power. First of all, realizing you're not alone. So often we don't talk about it, and you don't realize there are other people out there who are feeling just like you are. And it really just gives you comfort as well as the support. If one day you feel awful, at least you have this group who's also dealing
Right.
with the same,
Yes.
because it's never straight from A to B. It's always, a little zigzaggy along the way. But when you have that group, I think that's wonderful that you created that. So can you
Right.
just tell us a little more about the different pieces to it? How that, how the different parts of the program?
Yeah, yeah. So, it's on a platform where you would watch videos of me teaching you things, and then there's homework to do, and then there's group meetings every week for 90 minutes to discuss whatever it was that was discussed that week. And so we go in the beginning, it's mostly investigative. The first 3 weeks are investigative in terms of filling out some questionnaires and an intake. And this is the standard, functional medicine intake through the IFM. And so it's really putting our Sherlock Holmes hat on and gathering lots of data and looking at that, and then putting it all on a timeline and connecting the dots to see if there's any patterns that will help you to find the perfect storm that created the imbalances or the issues that you're experiencing and how that was expressed. And then we come up with a treatment plan that sort of reverse engineers all of those issues. But it starts with dietary. So food, I didn't mention food, and a lot of traditional doctors don't really connect the dots in terms of how food is medicine, that there are foods that are inflammatory and that there are foods that are healing. It's still to this day, there are many doctors or other medical providers that look at food as calories in and calories out. And
It's
that
certainly
there,
not a source of depression. It's certainly, I think very few in the conventional world or would say, oh yes, we must look at your food and just see if this
right,
is, yeah.
right. So very first thing is to pick the right diet plan or food plan for you. And then we go through all the different areas, like I mentioned. So infections, what infections, and we do offer a stool test to be able to look at the microbiome and look at supplements that might be beneficial, but those aren't actually necessary for this program. Those are things that could actually even be done at the end, because ultimately you can do a lot just by changing your habits, just by changing your diet. And by removing sugar, for example, can actually cause a die-off of candida, which is a type of yeast that is part of our normal flora, but it can get to be almost pathogenic or pathologic in the body and cause lots of symptoms. And just by withdrawing sugar, it starts dying off. And you can gain balance in your microbiome. So food can absolutely cause changes in your gut, even when at the level of pathogens, and they kind of move out of your body because you're no longer feeding them. The reason they stick around is because you're feeding them. And so you want to feed yourself and not them. And many people have a lot of nutrients deficiencies, and that's for societal reasons, the way our food system is set up. Many people actually don't even eat the right foods. Like vegetables are the most important thing that you can eat. I mean, we've been told that growing up for so long, but people don't really realize why, because the reason is because they're so full of vitamins and phytonutrients that in order for the processes on the cellular level to work, they need vitamins as cofactors and they need protein as enzymes to be able to function, even at the level of producing energy, on a cellular level. So you have to be able to provide those nutrients, and it's like, if you were building a house and you weren't given nails, like how can you build a house without nails, right?
So true.
So it's looking at every aspect of your life. So there's a psychological piece where learning stress reduction techniques, talking about meditation, talking about emotional freedom technique. There's so many things that we cover that you sort of get a taste of it, and you do it within the atmosphere of a supportive group. And if, like I said, if one person tries it, then you're more likely to try it and then support each other. So we really literally get through all the layers. And the most important piece of that is setting up habits. It's ultimately habits that actually gain wellness. It's not the fancy tests. It's not the fancy blood work. It's not the supplements even that really get you well. Supplements are actually a bridge to making things happen faster, but you can do it all just through lifestyle and dietary changes. It takes longer, it's a little bit harder, but you can actually achieve that just from lifestyle changes. And so the most important thing that doesn't actually happen as quickly in my practice is development of habits, because if you were to see me one-on-one, I'm telling you what to do and you're just doing it, but you might be doing it reluctantly or because I need to. But as soon as you start feeling well and the habits sometimes fall off because you're doing shortcuts or you're going on vacation or your job stress caused you to miss a meal or forget your supplements. And then those symptoms start creeping in. Like I told you about my son going off to college, right? All of these symptoms come back. And so it's really important to get habits in place that feel right to you, that's in alignment with your beliefs and your likes and dislikes. Like I had a patient the other day who she said to me, I know I have to get on my elliptical. I know, I'm so sorry. It's like, don't apologize to me, apologize to yourself, because you picked the elliptical. You didn't need to pick the elliptical. So we talked a little bit about, what would be more in keeping with what she really enjoys and is passionate about, and, that she could see herself doing for the rest of her life. And you know what she said? She said tap dancing.
Oh, I love that. So
Yeah.
fun.
So I said, well, do you have tap shoes? She said, oh yeah, they're in my closet. It's like, well, get them out. You could have a whole workout tap dancing,
Oh
right?
yeah. Oh, wow.
Yeah.
Absolutely. I
And you
couldn't.
love it, so like I play ultimate frisbee. I hate going to the gym. I hate exercising by myself or doing even yoga. As much as I love yoga, I don't like doing it by myself. And I was in the habit of doing it on a regular basis until the pandemic happened. And I started to doing it on my own, getting YouTube videos. It's like, I don't really want to do this. But ultimate frisbee is my sport. And you play outside, and you don't have the risk is so low outside. And so I play ultimate anytime I can get. And I look forward to it. I love it. I'm so passionate about the sport, and it doesn't even feel like exercise to me, but my body gets a workout.
That's so true, because so often people are on that treadmill. I have to do this, for my bones, I have to do this. And you're just sending negativity through your whole body. There's so many I couldn't agree with you more. Find something that you love and
Right,
enjoy
right.
it. Life's too short. You have to have fun.
Right. So these are the kinds of discussions that we have in the boot camp about it, about these things, getting habits in place that you will do, like you just know in your heart you're going to do and keep doing, and not let anything get in the way of it. You really have to make time to do what's right for your body, and you have to protect it. You really need to protect it, because ultimately, in the long run, that is what's going to get you through the tough times. It's how you develop resilience and get you through the tough times. You don't want to drop them off in order to handle the tough time, right?
Oh, absolutely. Oh, well, it's just so encouraging. And I think that's why I'm so happy that you came on the podcast, because, as I said, so many people are on antidepressants, and this time of year can be a time where people are feeling sad or what, and really do. And there are people who need help, who need to figure out, because a lot of times our habits go by the wayside with our food, with so many things that we're doing with our stress at this time of year, but
Right.
that there is hope, and that when we put all the pieces together, you can do this. And I think that's what's really exciting. So what's the first step, though, if someone's listening feeling depressed, or if they know someone who who just isn't themselves and is exhibiting those symptoms that you talked about, where they just seem every day to be low energy and feeling
Right.
so down? What would you say was the first step to start?
Well, certainly, if they're feeling so down that they're unable to function, or if they're having trouble thinking and organizing themselves to the point where they can't function at work or at school, and in the worst case scenario, if they have suicidal thoughts, chronic suicidal thoughts, or their mind is playing tricks on them, then you really want to get help right away. You might want to call 911, or you call your local mental health facility and get evaluated. That's really, really important. And making sure that you're safe and stable and able to function again. And because functional medicine, as beautiful as it is, and how I see a lot of people who've seen multiple doctors and have gotten really not so much better, and then they do the functional medicine approach. In order to do the functional medicine approach, you still have to function enough to be able to do the work of making these changes. And so you do have to have some level of organization, or I do see some patients who have had partners or caregivers that assist with people who are really sick. But it is having that assistance that's really important. So it is important to get help to address those acute symptoms, especially if it's putting you or others in danger. You want to take care of that right away. And that might require medication. So, just because I'm a functional medicine doctor now doesn't mean I'm anti-medication. I marry both worlds, and I prescribe medication, so a whole lot less than I ever did. but I still prescribe medications in certain situations when necessary. And so it is a combination of those things. But so getting help is really, really important. And then once you're stable, then you want to seek out a functional medicine doctor or do my boot camp, might want to do my boot camp. And in another example of that, because I've had people see me like, and I would say, you need to really be on medication right now. And I would refer them out for specific situations. Like, well, why are you doing that? I thought you were holistic. I was like, yeah, but you need acute care, and right now I'm only doing functional medicine for the most part. And so it's better to have someone keep you in care. And it's like, the example that I wanted to give is like, if you were hit by a car and had a serious neck injury and had multiple broken bones, you're not going to go right to rehab, right?
No.
Right? You're going to go to you're going to be airlifted out of the car through the jaws of life. You're going to be airlifted, to a hospital. You're going to have surgery done. Those bones are going to be placed in cast. You're going to recover probably 6 to 10 months, 12 months, who knows, however long it takes for you to recover. And then you go to rehab. And everyone knows that. Everyone knows that if they're conscious enough to figure that out, that this has happened to them, right? That they're going to get better with work, doing physical therapy, and those casts are going to come off. Those, and will be able to work will be able to function again and walk or whatever it is, those issues that caused from this accident, that with work, you will get better, right? It's the same thing with mental health. It's no different. So if you have an acute crisis, acute symptoms, it's sort of like being in a major car accident, right? And so you're going to do whatever you need to do to get stabilized before you do the work of psych rehab, which is what my boot camp is. It's like a psych rehab, and it's building back up and figuring out, well, what caused this in the first place, right? What happened. And so I don't know if that is a good.
Yeah, no, that explains it. So the nice thing I like, there's a lot of things I like about it, but I think the fact that you're a psychiatrist, because there's lots of programs that, I teach a happiness class, but this is different. This is really getting to the root cause of depression. And it's, and so the fact that you're a psychiatrist, you're not missing anything. You're making sure that all the components are in the program. And I also love the fact that it's live. And so that's when. So when does this start? So the
next boot camp is actually coming up really soon. It's good timing. So it officially starts on January 6th, but I like people to enroll as soon as possible, because you can start right away in the first 3 weeks. And then the groups start on January 6th with week 1. But because the first 3 weeks are kind of heavy with a lot of investigative tools, which people really love to, dive in and like figure it out. And sometimes it takes a little bit longer. So if you can, I think it's week 2 that takes a lot of time. And if you could take your time going through it and really putting on your thinking cap and putting all your history down, then it gives you the time to be able to do that instead of rushing through it. So I like to get people enrolled right away. And so, but then we officially start on January 6th of 2022. And so it actually is perfect timing for anybody who after the holidays really wants to, dive into it's a great, lots of people like to do New Year's resolutions. But this is a perfect way to really, invest time and energy into your mental health, but also your physical health and your immune health. And with if you don't mind me saying, with Omicron on the horizon, what better way to deal with that than to support your immune system, right? So
absolutely. It permeates everything. It's really, you can't really get well and not have this peace. I believe if you're someone that really is suffering and having issues, you want to find out. And as you said early on, once you figure out what the root cause is, it's so much fun when everything gets better. Things, so many people think they have to live with things, but then when you figure out the root cause to one thing, the body is all connected. It's always, I find it's always so nice when, someone's bones are improving and their eczema is gone, their gut issues, and then their mental health is better. So it's such a win-win situation. So it's really, that's exciting. This program
It
sounds
is. Oh,
really,
thank you for
really,
asking.
yeah, no, my goal is to help people, and my goal is to really spread information. And I think it is so frustrating that so many people I see, so many women are on antidepressants and just don't realize that it doesn't have to be that way, and that there's other possibilities and root causes, and there's action steps they could take. So I'm just really, really thrilled to have had you on and explain this. Is there any last minute thing that, I mean, we could talk for, there's so many things we
I
could talk
know,
about.
yeah, we
Is
could
there any?
talk forever. Yeah, so if people are interested, I'm assuming that you could probably put a link in the show notes
Yes, absolutely.
of how to contact me. I recommend that if you are interested, if they are interested, or a family member who might be interested, is to just make a discovery call with me. I'm happy to talk to you. It's free time, and you just go to my schedule, and that will, the link will bring you to, and I'm happy to talk to you about whether or not it's right for you.
Oh, that's
Yeah.
wonderful. So if someone really doesn't know, that's great, Dr. China. Fantastic. Oh, great. Well, thank you for all the work you do. Is there any last minute thing you want to leave everyone with, any inspiration as we get into the
Well,
new year?
you said it before, but I think it's worth repeating, is that there is absolutely hope, and I think it's important for people to trust their intuition about things, that, sometimes women, at least the women that I've seen, and men, like they recount, being put on an antidepressant and it didn't work, or they had side effects, or they were stuck on it and had withdrawal symptoms. It's like, I didn't think it was the right thing for me, but I didn't have any other options. I didn't have any other solutions presented to me, and so I took it. And so it's, if you have that kind of feeling, that it's important to search for other options in terms of people to help you, because not every doctor knows everything. We're all human. And so I think there needs to be a little grace around the provider, that they're not bad people. They're doing the best that they can with what they know. And I think it's important to remember to just listen to what your mind, body, and spirit is telling you. And if it doesn't feel right to you, to search for someone else, to have at least the discussion, is this right for me? But also know that there are other options. And functional medicine is a very viable option to address the root causes of your depression and anxiety, by the way. My book could have easily been called "What If It's Not Anxiety?" because it's the same, it really is the same root causes.
Yeah, well, that's so great. And thank you so much for all this incredible work you're doing and just really helping people all over. So, and thank you for taking the time to be here today.
Thank you. Thank you for inviting me. It was such a pleasure.
Oh, thanks so much. I hope you enjoyed my interview with Dr. Achina as much as I did, and now have a better understanding of depression, what it is. And the good news is that there's so much that can be done when we look at it from a functional medicine perspective. All the links we talked about will be in the show notes, as well as the link to Dr. Achina's bootcamp that's coming up soon. So thanks so much for tuning in, and I look forward to seeing you on the next episode.